You want to be an EMT. You feel it right here. Being an EMT is important to you. You're nervous about class. What's class going to be like? Can I do it? Maybe you have no medical knowledge whatsoever going into class. Limmer Education has a product for you called EMT Class Ready that will help get you ready for the class. I'm going to take you through a little tour of some of the things that this class will teach you, starting with the EMS system itself. EMS is actually an exciting profession. It's something that's really interesting to do. Your class will be the same way. The concept of working in an ambulance, working with really great and fun people that you have, and the practice that you're going to do in class, realistic simulations like you'll do in the laboratory, maybe even going out to a fire station doing clinicals out there. The EMT class and what you're going to do is going to be very exciting. Let's look at some of the components of your EMT class. Now, an EMT class has 3 components. All of these are really important. You may normally think of 1 or 2 of these, but I want you to think about all 3, just to know what you're going to be getting into as an EMT student. Now, the classroom and the knowledge part about what you do is a really big part. You've got to know about broken bones and allergic reactions and heart attacks and asthma. There's a lot of information in there, and that comes from the classroom. Now, that can be in person. You can go to a training facility, to a college, a couple times a week and get that information. Sometimes a lot of the material can be done online or can be video-based or otherwise. But that learning management system that you have usually is the anchor. It's the place where you'll go to get your assignments, to figure out what you need to read or fill out, and more importantly, to get your grades. Now, the skills laboratory is the part people really think about. Getting into the lab, right? You can get into class, you've got somebody as your patient there on the floor, you've got your stethoscope, you've got your uniform, some trauma scissors on your belt, you're ready to go and be an EMT. The lab is really exciting, a little nerve-wracking, especially the first time you do any skill, but you can do it. The more you do it, the better you get. And that's the concept behind this laboratory practice. Now, the classroom and lab come together to put you out, usually in some sort of clinical experience. Now, depending on your class, depending on your state rules, depending on what's available, that clinical experience might be going into a hospital emergency department. There, you might work with a preceptor from your EMT program or possibly a nurse or physician that's going to take you from patient to patient. Now, that's a little anxiety-provoking going into that, but the learning you get is so important. Why do we send students to emergency departments? Because that's where all the sick people come. You get to see them all in one place. You can get a lot of experience in one 8 or 12-hour shift. It's really awesome to go in there and do it. Like I said, a little nerve-wracking the first time you're there actually doing something clinical. You should be practicing vital signs. You should be seeing people with different conditions and injuries, maybe getting some hands-on experience doing that, even thinking. How does a clinician think and what to do? You may also go out into the field. Being on an ambulance is a great way to get some clinical experience. And what these clinical experiences do, they help cement all that stuff you have learned in class and lab into one thing where you're ready to go take that exam and go out and be an EMT. There are 4 different levels of EMS providers nationally in the country. We have the EMR, or Emergency Medical Responder. Generally a course that's 40 to 60 hours, right? You're here at EMT. This might be for the firefighter, for the industrial responder, for someone who's not necessarily part of the EMS system directly, but they're going to do that life-saving stuff in those first few minutes of an emergency. You're studying to be an EMT. I'm guessing you're going to be looking at 150, 200 or more hours of classroom time, of laboratory time, of clinical time. The EMT, this patch you're going to get when you pass the national exam, is a big thing, and I want you to wear it proudly. It really means something. This is the level that most people say is the minimum level required to be on an ambulance. That's a big responsibility, and you're here. Now, I hope that you love your class and that you want to go on and advance your EMS knowledge. There's 2 more levels above EMT. The first is Advanced EMT. Advanced EMT adds skills like IV lines, advanced airways and some medications. A little bit more education and thinking as well to put that all together. It's a great step, and AEMTs can do a lot of things. Paramedic, right? This gold patch, sometimes referred to in the business as the disco patch because it's gold, and when you see the patch on a uniform, it's got that shiny thing going. Paramedic takes a year or two to get through and do. There's a wide range of medications. The things that can be done are amazing. If someone's heart stops, to be able to interpret the rhythm, to shock the heart, to give all the medications required to start that heart and ultimately bring the patient back to life, a lot of that falls to the paramedic, relieving pain. But you think of all the skills, but as we go through all of these individual certifications, do you know what else goes in there? It's the thinking, it's the knowledge. That's the ability to do more. All those skills comes with a lot of knowledge, more time as we move up. So those 4 levels, and this is something that you could actually be tested on. You're learning it now. Emergency medical responder, EMT, which is what you're going to do. We're going to help you get there. AEMT, and of course at the top of our list is paramedic. That's the first lesson in this mini version of EMT class ready. It's kind of what you're looking for. We're going to get a little bit deeper in the next 2 videos, okay? We're going to teach some medical terminology. We're going to get into a little bit of physiology and even give you a couple of test questions in this next segment.